Welcome to the Clinical Skills Podcast for Female Catheterisation. This podcast will cover the procedure for the insertion of a female urinary catheter using a Foley catheter only. Urinary catheterisation is the passing of a plastic tube known as a catheter through the patient's urethra into the bladder to permit the passage of urine. We start with an overview of the indications and contraindications of urinary catheterisation, assessment of the physical and psychological needs of the patient, choosing the correct equipment, and standard precautions. The procedure for insertion of a female urinary catheter is illustrated fully, and some of the possible complications are described. Indications for urinary catheterisation include diagnostic indications such as obtaining an uncontaminated urine sample for microbiological testing, to measure urinary output in critically ill patients or during surgery, and to instill contrast media for imaging procedures. Therapeutic indications such as bladder decompression in patients with acute or chronic urinary retention, and the hygienic care of bedridden patients. The principal contraindication for urinary catheterisation is urethral injury as a result of trauma or disease. It is important to address the individual's physical and psychological needs which are dependent on and influenced by the patient's condition and circumstance. Assess how appropriate or necessary this invasive procedure is for your patient. Recognise that there are some circumstances when assistance may be required, for example if the patient is confused or very anxious. Before commencing the procedure, identify yourself to the patient. Check the patient's name, date of birth and hospital or community health index number and confirm this against their wristband. Clearly explain the procedure to the patient and request consent before continuing.
Hello there.
Oh, hiya.
My name's Tahir Kwayum.
Hiya.
Can I ask you your name and your date of birth, please?
Yeah, it's Kirsty McNair, 29/9/65.
That's fine. I hear you're having some difficulty in emptying your bladder.
Oh, it's terrible.
One of the ways that we can help you
Yeah.
is if we insert a catheter into your bladder.
Right, what's a catheter?
What that is it's a plastic tube that we insert via your water pipe into your bladder, and it allows all the urine to drain out, and it decreases the discomfort that you're going through at the moment.
Because it's absolutely murder. Is it sore?
It's slightly uncomfortable,
Right.
but we give you some local anaesthetic, which is a lubricant, to ease the discomfort, and it'll be a temporary measure until you're fully mobilised, and then we'll take it out later in the future.
Because I've been having all these flus and my bladder feels it's up to there.
You've had an operation.
Yeah.
That's one of the complications of having difficulty in peeing after an operation.
Oh, right, okay.
It's like I said, it's slightly uncomfortable.
Right.
We'll give you a slight clean around the water pipe, insert the urinary catheter in, and hopefully the pain will ease off after that.
Oh, I hope so.
Would that be okay if we proceed?
Yeah, that's fine.
Okay.
Thanks.
What I'll do, I'll get everything set up on the trolley.
Okay.
Then I'll come back through. And
Will you be long?
No, it won't be long at all.
Oh, great.
And we'll take it from there.
Thank you.
The following equipment is required for urinary catheterisation: a sterile catheterisation pack, a disposable pad, sterile gloves, anaesthetic lubricating gel, syringe, sterile water, antiseptic solution, alcohol wipes, an appropriate catheter, a disposable plastic apron, a clean tray, a universal specimen container, and a drainage bag. It is important to thoroughly wash and dry hands following the correct clinical guidance. Before proceeding, put on a clean disposable apron. Without touching the inner surface of the sterile catheterisation pack, remove it from its packaging and open it out on top of the trolley. Place the sterile gloves and other supplementary packs onto the sterile surface, taking care not to touch the items themselves. Using an alcohol wipe, cleanse the opening of the antiseptic solution and pour it into the container. Using a non-touch technique, remove the catheter from its packaging and place it onto the equipment trolley. Cleanse the container of sterile water using an alcohol wipe and remove the seal from the ampoule. At this stage, double glove before proceeding. The patient should be positioned supine with knees bent, hips flexed and feet resting about 60 centimetres apart. There is no need to fully expose the patient at this stage. Place a disposable incontinence pad under the patient's thighs. Carefully draw up the sterile water into the syringe. Separate the labia minora with one hand to reveal the urethral meatus. Clean around the urethral orifice with an antiseptic solution using single downward strokes. Remove the outer layer of gloves, being careful not to touch the underlying pair. Place a clean drape over the patient's genital area. Using one hand, gently separate the labia minora and insert the nozzle of the lubricating anaesthetic gel into the urethra. Expel the contents of the syringe into the urethra and allow 5 minutes for the antiseptic and anaesthetic properties to take effect. Begin by carefully removing the plastic covering from the catheter. Introduce the tip of the catheter into the urethral orifice in an upward and backward direction. Place a tray on the bed between the patient's thighs and place the distal end of the catheter in the tray. Slowly advance the catheter until 5 to 6 centimeters has been inserted. When urine begins to flow, advance the catheter a further 1 to 2 centimeters. Attach the syringe containing sterile water to the end of the catheter and inflate the balloon to secure the catheter in the bladder. Cleanse the drainage tube with an alcohol wipe and attach it to the catheter, ensuring that the bag is secured and that the tube is positioned in such a way as not to occlude the lumen. Remove the drape and dispose of as clinical waste. Urinary tract infections are common following catheterisation, and some patients are at increased risk. For example, elderly, diabetic, and critically ill patients. Risk of infection can be decreased by closely following the correct aseptic technique. The risk of infection is always greater the longer the catheter remains in place, so careful consideration should be given to ensure catheterisation is absolutely necessary.